I want to introduce Sonja from Sunshine Therapies. Sonja has more than 40 years experience in the skincare and massage industry. She specializes in electrolysis hair removal treatments, restorative high-end facials, detoxing, reflexology, and ozone treatment. And Sonja is situated in Parkwood, Johannesburg. Welcome, Sonja. Thank you for your time today.
Thank you, Bia. It's a privilege to be here.
So today we're mainly going to talk about facial hair and electrolysis, and then the difference between electrolysis and laser, and then maybe some tips like why not to pluck your facial hair. And then we can share a little bit of my story and my treatment with you. So welcome.
Thank you very much. Okay. Yes.
So Sonja, should we start talking about hair and electrolysis, and then explain the process of electrolysis for the viewers that don't know what it is?
Okay, yes. So the first thing that is important to know is that whatever hair you have on your face, especially in this part, should never be plucked. If you shave it, you are not stimulating the hair growth, but you are irritating the surface of the skin, and that could lead to ingrown hairs. If you wax it or pluck it or remove it with force, you are only stimulating the hair. So for me, it's very important for the ladies to understand that different parts of the hair growth on the body is stimulated with different hormones. So the hairs on top of the head versus the hairs on the side of the head are two different hormones, and hence if men go bald, they only go bald on this part because of the testosterone involved. Similarly on the face. If you have hairs on your lip, it could mainly just be something like a bit of hereditary, strong hair growth in the family. But the moment there's hairs on the chin and on the cheeks, then it is hormonal. And that is very important for women to understand that. Yeah.
Okay. Yes. Yeah, I also, with a lot of my research and my personal experience, is that I know it's definitely hormonal related if you have the hairs on the chin due to higher testosterone levels. And I think a lot of women that are diagnosed with polycystic ovary syndrome are more prone to have the hair on the chin. So I think that's something that women can know. If they start getting these hair on the chin, they can go to the doctor and do a blood test and see if they have higher levels of testosterone. Okay, but now, how do we remove these hairs? And what is the difference between the electrolysis, hair removal, and laser?
Okay, so for one, the electrolysis, because I've been doing it for 40 years now, I can guarantee you, and it's also stated on the internet, known as a permanent hair removal. So once you do electrolysis, once you've committed to that, whatever hairs you destroy, once you've destroyed them, they don't grow back. Similarly, in laser, the hair gets damaged, the hair gets retarded, but they can never kill the hair germ cells with laser. So they will always be dormant there. So whatever irritation happens in the system, fluctuation of hormones, shock and horror that happens in us, around us all the time nowadays, that dormant hair germ cell that sits in that follicle can be stimulated again, and whatever hair was retarded with laser can now come back. That's the difference for laser versus electrolysis. But now, after working with laser, it's only been on the market for the last 10, 15 years. So after working in my own personal, I've had hair growth on my face, polycystic ovaries or whatever goes with that, hormonal imbalances. I have noticed, and it was such a shock, that every time I went for laser, because it's wonderful to remove body hairs and to retard the growth, underarm, leg hairs. I have no hairs on my legs anymore because I had laser done. But whenever they did it on the face, the big hair would go smaller, that was there, and I would get a cluster of hairs, new hairs, where the laser beam hit that area, the rest of the hairs were stimulated because it was just enough to stimulate and not enough to kill the fluffy hairs around. So then I would get these patches, and whenever I complained to the laser therapists and doctors, they would say to me, no, I'm definitely imagining this. And then until I read it on the internet that it's known to do that on this part of the face. So for me, that is vital. Ladies must know that if they want permanent removal of hairs on the chin and cheeks, that's where they need electrolysis. They can try the retardation way with laser, especially if they have very dark hair, because then all the hairs will be retarded. And important to know that that's what laser does. It targets the color in the hair. So with electrolysis, I can take out any hair. With laser, you can only take out dark hair. On electrolysis, I can do it on any skin tone, any skin color. On laser, you can only do it on lighter skins. They have now devised machines that works a bit better on darker skins, but even that, I find that electrolysis is more effective on pigmented skin. Problems with laser is that ladies will have laser on their faces and then their skin will be photosensitive. The moment they go into the sun, that area that has been treated with the laser, and it's, they shoot a beam, and that beam hits a certain area, so that whole area has been stimulated, and then you can get these brown or white sometimes spots on the face from laser treatment, which you don't get from electrolysis. Electrolysis, on the other hand, where laser is virtually painless, electrolysis is quite painful, and you can talk out of experience. But we can put local anesthetic on. I've even had a client who would go to a dentist and have herself injected, and then I can do the current as high as I want because she didn't feel anything, and that was for her the only way she could do it. Yes. Don't recommend that because I'm very anti whatever goes into the skin that's toxic. So preferably local anesthetic and not something that goes into the blood system like that. Yeah.
I agree with that, Sonja. And you know what? Many years ago, I went for a few laser sessions. And then I think it was on my second one, the therapist said, no, but if you have a hormonal imbalance, you should not do laser. And it was quite shocking for me because they didn't ask that before I started my treatment. So I immediately stopped. And actually just meeting you, it made that connection. Okay. That it could have actually stimulated my hair growth even, and to make it worse. So I really do feel that. And I think that's something that people don't speak about. Laser is very easily recommended, especially for PCOS women. So thanks for sharing that. I think it's very, very important.
Yes, and I think if somebody can do a laser treatment and establish whether it does affect the hair growth around the existing hair that they wanted to treat, and see maybe the laser works. But if you do that and you have now double the amount of hair that somebody with electrolysis needs to treat, that means it doubles up you need double that amount of treatment. So
exactly.
Personally, if there's hair growth on this part of the face, do electrolysis.
Yeah. And for me, I met you, I think, very far down my journey. Because I remember my dog, I don't want to say darker hair, but I started growing more hair on my chin when I was about 20. And I met you 8 years down the line. So I think if I started with electrolysis much quicker, it would have, of course, been so much easier.
Yes.
And for us to remove all those hair much, much more quicker. So I think that's also something that I want to get across to people is really invest in electrolysis as early as possible.
Yes, yes.
It's very important. I think if I met you when I was 20, it would have been amazing.
Yes.
So is there a certain age where you can see the growth starting, or?
Round about 18, 20.
Okay.
Most of my clients who come for laser are in their menopausal phase. Okay. And all women that stop having their estrogen, and when the estrogen starts dropping, will have a surge of hair growth.
Yeah.
So my major bulk amount of clients is usually menopausal. And you know yourself how small that percentage of people are with polycystic ovaries or the hormonal imbalance that will cause hair growth, and not necessarily always polycystic ovaries. So I don't want to put facts on that, but I do know that when girls can start quick enough with when there's a hormonal imbalance, that it is far better for them.
Yeah.
So when you want to explain to somebody what electrolysis is, I think it's important that people know that it's a very fine needle that goes into the follicle, not into the skin. You don't probe the skin. So the needle needs to go into the follicle. Can you imagine each hair individually done like that? And then the setting will cauterize the hair germ cells at the base of that follicle. Whereas laser, you can just shoot. You don't have to penetrate or anything. So it's extremely meticulous work to do electrolysis. So firstly, you have a client, they have to consider the pain, they have to consider the fact that they have to lie here for either 10, 20, 30, 40 minutes. You know yourself, sometimes it can take very long to clean an area. But in the long run, if you start early, if you prevent those hairs from growing stronger, that initial phase needs to be done immediately when you start seeing hair growth in your face. And I've seen girls and they pluck 1 or 2 hairs. Next time when I see them, they have 7. Because when you pluck a hair, there's always 1 or 5 little hairs around that at this stage of the game is still just a lanugo hair, just a baby hair. You stimulate it, it becomes a terminal hair, and then you sit with that. You sit with stronger hair growth. Even though you just plucked out the one, in your mind, you did stimulate hairs around it. Even plucking that one hair can even stimulate the hairs just by the stimulation of that pluck. So no plucking, have electrolysis quickly as possible, and be aware of the fact that if you have hairs on the face, the laser will very often, if not always, stimulate the growth around that spot that has been lasered.
Yeah.
Oh.
Thanks, Sonja. That's a perfect summary. And now we can actually, I would like to share my personal journey and my personal journey with you, because you really changed my life. When I came to you, I was very self-conscious. I remember I needed to take at least half an hour in the morning to pluck my hairs. That's what I did. I needed to remove my hair every morning. And for me, it really made me very self-conscious. I remember I was scared to go into light because you can see the dark hairs on my face. And so my treatment with you, I think we started, it was 2 years ago. And I think I really suffered from severe hirsutism, or the male pattern hair growth. In the beginning, we did take an hour. And for the ladies, please, if you go for electrolysis, to avoid the week before your period starts.
Very important.
You are so sensitive. So, just that's a point. That's something that is very important to note. I always used to message Sonja and say, okay, cool, I can't come. It's almost my period. It's going to be too sore. But after our really investment in time for me, after a year, I think I could see a huge difference. And we did the first sessions every
week,
every month, every month.
We initially started weekly because remember you had hair growth in different phases because of the plucking. You had to get them to grow out in batches from there onwards.
Yes.
So what is also important to know is that once you do a hair, we've probed the follicle where the hair grows in, and you've burnt that hair germ cell. Doesn't mean you've burnt them all. So, and to burn them all will possibly cause scarring. So we don't want to scar. We always want to make sure that there's no scarring. So the needle goes into the follicle. We cauterize the hair germ cells. Some of them survive and they regrow. So up to 3 times you have to burn a hair to make sure that you've killed all the hair germ cells. So unless they're stubborn or they got stimulation, whatever, sometimes 3 to 5 times is necessary. So if you think I can do up to, per minute, I can do up to 10 hairs per minute. So putting an hour session in means that you've done so many hairs.
Yes.
And yet that's only the ones that were visible at that time. It's also important to know that the stages of the hair will come in and the plucking would have affected it. But if you're coming in, can I call it virgin growth? Because that's the thing. Virgin growth, if you've waxed your bikini line for the first time, it will bleed. And that's why we call it virgin growth. And the hairs on the chin, if they're virgin growth, if they're fresh, they've never been stimulated, will die quicker. So once you've stimulated that hair, you've plucked it, you've waxed it, you've shaved it, you've put nail products on to eat away the hairs on the face. Yeah. All those things were irritating on the skin. And then you've actually hampered your treatment process. So if you can do it and it can be virgin growth, you are far better off. Just wanted to clarify that. And with you, we didn't have that. We had a laser mishap with you where it stimulated the growth. We also had the fact that you've plucked and that you've plucked many years. So if you've plucked it once, it'll be stronger. But if you've been plucking it for 8 years, you have made a terminal hair growth that is not a happy thing for a girl to have on her face. And that's, we don't like that.
Exactly that. So for everyone that's watching this video, I 100% recommend that if you have any hair growth on your face and you suffer with anything like PCOS, please contact Sonja. It's so worthwhile. It's really life-changing. I really feel like a woman again. I think in my process, I felt, you feel ashamed actually, but I changed into really loving myself again and like reconnecting with my womanhood, and really gaining my confidence. So I'm definitely going to share your contact details for anyone that wants to contact you. And of course, I never had any scarring or anything afterwards because you are so gentle. And yeah, I just felt your energy is beautiful. So it was always a good thing to always come with you and have my session, and just release some of that old energy of my self-consciousness. So Sonja, just thank you for who you are. And you've literally, doing wonderful work for so many women.
And if I find women like you on my way, I mean, you were so feminine. There was nothing unfeminine about you. So for me to have been able to restore the balance for you that made you feel unfeminine, I get goosebumps. It's such a privilege. Thank you very much.
Thank you, Sonja.
Thank you. Thanks.